Welcome to Seniority Authority, the podcast where I track down experts to answer your questions on aging. I'm your host, Kathleen Toomey. Let's get smarter about growing older. As humans, we're hardwired for life. Our instinct is to keep going, hang on to our lives, and never give up, to choose to persevere in the face of adversity. And that's a good trait. But what happens when you face the end of your life? That's something none of us can plow through and succeed by sheer force of will. Of course, we're going to try every treatment, modify what we can, but it's not always possible. We are all going to pass away. Yet there is support for that last act. And this is what we're going to dive into today. Welcome to Seniority Authority. I'm your host, Kathleen Toomey. Today, we're going to unpack the concept of palliative care. It's a term that's widely misunderstood and often feared by people. Today's very special guest, Minnie Sabin, is an experienced nurse practitioner who focuses on palliative care and who currently works at Exeter Hospital in Exeter, New Hampshire, part of the Beth Israel Lahey system. Minnie has been part of the palliative care team for 7 years. Minnie, I'm thrilled to have you in Seniority Authority.
I am delighted to be here, Kathleen. Thank you so much for having me. I'm excited because you're right, this is such an important topic.
It is. Tell us, how did you first get into palliative care?
I have to say, it wasn't a direct, straight line to palliative care. I actually started my career in public service, and then I moved on to philanthropy. I fundraised for hospitals in New York City and in Chicago. And it was during that time that I really developed an interest in nursing. So while I was raising my 2 kids, I went back to nursing school.
Not easy.
Yeah, no, it wasn't. So I was a registered nurse for some time, and then I decided to return to school again for my nurse practitioner degree. And I have to say, I was intrigued by palliative care. I didn't know much about it, but I was intrigued by palliative care. And the more I learned, especially the holistic approach to palliative care, I really felt that the work resonated with me. It's really about working with patients and families. I find it to be so meaningful, and I feel it's a privilege to work with patients and their loved ones. These can be very personal and vulnerable moments in their lives. And I feel it's a privilege to be able to be part of that and take that journey with them. And I am just so grateful to be in this line of work.
What did you study to enter the field of palliative care? And is it fairly new?
It actually is a fairly new field. Palliative care concept has been around since the 1900s, but the specialty has been around since the 2000s. So for my specialized training, I received a certification through the American Academy of Hospice and Palliative Medicine. And it's fairly normal for each discipline to have their own specialized training and certification.
Great. And before we get too deep into this, can you please help our audience and our listeners understand, what do you mean by palliative care?
Oh my gosh, of course, certainly. So palliative care is a specialized medical field that basically is for patients that have serious illness. And the goal is to improve quality of life for patients as well as their families.
I think a lot of people confuse palliative care and hospice. Minnie, can you help us define those two different disciplines?
Oh, absolutely. So palliative care, and I should have mentioned this earlier, is something that is offered at any stage and at any age. So it can be provided to you when you are initially diagnosed with a serious illness. We often also meet patients when they're in an advanced stage of an illness. The big difference is that palliative care is provided alongside with curative treatment. And hospice is a Medicare benefit that is really focused on end of life. And it's provided when you are really in the last months of life. As long as you meet the Medicare requirements for hospice, you can have hospice. But it's usually when you have decided that curative treatment is no longer an option for you, or that you've decided that you rather not have curative treatment.
That is a great definition. So, palliative care works alongside curative treatment, and hospice is when you've decided to elect out of curative treatment.
And another misconception is that patients feel that they have to give up their doctors when they have palliative care or hospice. And really, palliative working alongside your primary care provider as well as your specialists. So again, we work with your oncologists, your cardiologists, any specialties that are involved in your care.
Great. When do most people use palliative care, and what are the benefits?
Patients who have serious illness that is starting to impact their quality of life are often referred to palliative care. And it depends on the setting. So possibly your primary care provider is making that referral, or a hospitalist, because you're in the hospital and you've been there multiple times, they feel that it would be important and beneficial to you and your family to have care involved. Benefits are many, really. Symptom management support for you, support for the family, enhanced communication with your medical team, coordination of care, and in really improving quality of life for the patient as well as for the loved ones. I have to add, too, that it's very beneficial as a whole for hospitals to have palliative care involved. It really has shown to lower readmission rates, shortens lengths of stay for patients, and overall lowers costs.
Okay. Tell us a little bit about the makeup of a palliative care team. It's not just you, the nurse practitioner, as I understand it. Who else is involved?
So ideally, it's an interdisciplinary team. A palliative care team can be made up of doctors, nurse practitioners, physician assistants, registered nurses, social workers, chaplains, and even pharmacists.
Wow.
Everyone is bringing in their expertise. And really, the purpose of each person on the team is to provide support, because we're not focusing on just the physical aspects of someone's care, but we're really taking a holistic approach to patient care. So it can be suffering through, again, symptom management, a symptom overburden of symptoms, but also spiritual distress. There are psychosocial barriers that can impact somebody's quality of life.
Sure.
So it's really taking everyone's expertise and coming together to help the patient.
It sounds like it would really be very beneficial for people, but I sense that there's a resistance to electing for palliative care. Who should be on palliative care, but often declines? And what's that all about?
You're absolutely right. There really is a misunderstanding out there of what palliative care is. And people often do really confuse us with hospice. And I think anyone that has an advanced disease, a serious illness, would definitely benefit from our support at any point during that disease trajectory.
I know this is probably an impossible question to answer,
Yes.
but how long do people typically stay on palliative care?
The great thing about palliative care is its adaptability. We're really meeting patients where they're at in their illness journey. So it could be initially when they're diagnosed with a cancer, for example, or it could be when they are in the hospital and they find that they are in need of symptom management support while they're in the hospital. It could also be that we're finding them closer to end of life.
Mm-hmm.
It is, again, it's a specialty that can be offered at any age and any stage of the disease process. And patients can benefit from palliative care and can stay on palliative care for as long as they want to be on palliative care. It really is where they're at in their illness journey.
That's great. Without revealing any names or any details, can you give us a glimpse of people who have elected for palliative care and what their experience was like?
Absolutely. Absolutely. I'll call this patient Mr. H.
Okay, great.
So, Mr. H is a gentleman in his 70s. He has mild to moderate dementia. He also has COPD and has multiple hospitalizations. He recently moved in with his son, and his son became his primary caregiver. And the hospitalist referred him to palliative care. When I first met Mr. H, he was still able to make his needs known. He had short-term memory issues, but he was still able to share with us what his wishes were. He felt that he was a burden to his son, and his son felt that he was very overwhelmed with his father's care and wasn't sure what to expect for the future. So it was really an opportunity to sit down with both of them and talk to them about what is important to Mr. H, what he wanted for the future, what he didn't want for future medical care. And it really provided his son with some clarity and some confidence as a decision maker. It also was an opportunity for the son and Mr. H to meet with our social worker and to be able to talk about practical things like community support, as well as talk about caregiver burnout and find resources for both of them. So we were able to get things on paper. We were able to have frank, but obviously important, essential conversations that helped create a path forward. And hopefully it provided Mr. H as well as his son with some peace of mind that they had an understanding of what to expect as far as to disease trajectory as things progressed, and also have an opportunity to have those frank discussions and talk about what was important to Mr. H and really define what the goals of care are or were.
That sounds wonderful. And as you talk about that and thinking about family dynamics, I would think it
Yes.
might be easier for them to talk through and with another
Yes.
professional as opposed to caregiver and care receiver who are going through unusual and different relationship.
Yes.
And then to add that on top of it, it's almost impossible. So that's a
Yes.
great example.
Absolutely. There are obviously conflicts in family dynamics and what a patient may wish for, what a family member may wish for. And this is an opportunity to kind of bring them both all together and have that discussion and be somewhat of a mediator, right?
Because when you have someone that you're caring for, and especially if it's a parent child, there's a lot of dynamics that are reversed and can cause a
Yes.
lot of friction.
Yeah,
So I think that's
absolutely.
great. If our listeners are intrigued by this and if they feel that they're in a situation that might benefit from palliative care, how do they find palliative care in their area? Understanding that some people are listening in California and Texas and Michigan, where should they go? Do they go to their
Yes.
primary care?
Absolutely, yes.
Okay.
If they have a primary care provider, they should discuss this with their primary care provider or their oncologist or their cardiologist. A lot of cancer centers have a palliative care team, and most academic centers in the country are starting to have palliative care teams embedded in their centers. So I would talk to the primary care provider or the specialist that they're working with. In Massachusetts and in New Hampshire, there's also, in order to start these conversations, there's also a website that patients and families can go to. It's called the Conversation Project.
Oh, yes. We've done an episode on the Conversation Project, actually.
Yes.
It's a great
Yes.
organization. And I will put their website in our show notes for listeners who are interested.
Yes. We find that the Conversation Project, the questions that are posed in the toolkit are very important and really help patients when they have questions that they want to ask their doctors. And it also helps their family members come up with ideas and ways to talk to the patient as well about what's going on.
It's a very valuable resource, and you can find that in our show notes. Minnie, do you have suggestions for resources or books that you think people who are interested in this topic might enjoy reading?
Yes, I do. Actually, I feel that everybody should read Being Mortal with Dr. Atul Gawande. I think his book really just emphasizes the importance of having these conversations. He also has a frontline documentary about the medical system and palliative care. And I think everybody should watch that. It's available on YouTube. Other books, and I can provide you with a list as well, but other books are Dying Well by Dr. Ira Byock, as well as When Breath Becomes Air.
Yes. These are some of my favorite books, and I completely agree. Everyone should read Being Mortal.
Yes.
It is such a statement about how we are focused on fixing, but we are mortal. We need to accept that and make different sorts of choices in life. And it's so powerful.
Absolutely.
Such a great read.
Yes, I agree. Yes.
And how do you stay motivated as a palliative care professional? What do you get out of the job that keeps you going? Because it's a challenging job.
I really do appreciate being allowed to be part of those conversations, being invited to be part of those conversations by families, patients and families. That is probably the most powerful part of my job that fills my cup.
Yeah. Talk about making a difference every day in someone's life. You know you're doing that with this work.
I hope we are. And the reality is that with the aging population and the prevalence of chronic illnesses increasing, palliative care is going to continue making a difference, and it will be needed. There is a need there. So I'm hoping that, we can get the word out, and podcasts like this are certainly appreciated because it's really public education that is needed to have a better understanding of what palliative care is. But it's such an important specialty that, again, can be provided alongside any curative treatment, and really appreciate this opportunity to just talk about my field.
I want to say thank you, Minnie, for not just your time today, but for choosing being a nurse practitioner and choosing palliative care, because you are one of the real heroes in healthcare these days. It's a very difficult conversation that a lot of people shy away from, and you just charge right into it and help people feel comfort and compassion and solace at a time when it's very difficult to find those. So thank you. And thank you for being here today.
Thank you, Kathleen. Really appreciate it.
That's our show for today. If you enjoyed it, please share it with a friend so we can capture more minds. Like and follow us on Facebook and Instagram. And until next time, enjoy the chance to get smarter about growing older. That's our show for today. If you liked it, please tell your friends so we can reach more minds and keep the conversation going. Or follow us on social at Seniority Authority. I'm Kathleen Toomey. Until next time, enjoy your chance to get smarter about growing older.